The FDA released new guidance last week that would ease blood donor restrictions for gay and bisexual men. The agency says the changes are necessary to, quote, maintain an adequate blood supply. About 25% of U.S. community blood centers have a one-day supply or less. That's according to America's Blood Centers Daily Tracker. We want to bring in Cole Williams. He is the founder of Pride and Plasma, an organization working to end the FDA's ban on gay men donating blood. Thanks for joining us. I got to tell you, when I saw this topic, I thought that this was already lifted. I thought we had, don't you remember we had a conversation years ago, Vlad, with someone about this?
Yep.
And I thought this, so just for people who are unfamiliar, just sort of take us back and tell us, why is there a ban in place now, and what is the FDA proposing?
Yeah, of course. So in 1985, the FDA released the queer blood ban, as those outside of the policy people call it. And it was put in place because it was the middle of the AIDS epidemic. We didn't really understand HIV completely, and we didn't have adequate means for testing for it. So when the FDA, CDC, all these health organizations saw that HIV and AIDS were popping up in the LGBTQ population at a much higher rate, that's when they put in this policy. And then it was in place. It was a lifetime ban, and it was actually retroactive. So if it was any man who had had sex with another man since 1977, they were given a lifetime ban from giving blood. That was held in place until 2015, when it was cut back to 12 months, thanks mostly in part to the work of the National Gay Blood Drive. And then in 2020, probably what you were talking about just now, they cut it down to 3 months, and that's what has been in place until Friday, when the FDA released updated guidances.
So what does this mean now going forward?
So right now we're going into a public comment period. That means that for the next 60 days, the FDA will review comments and then vote upon it. And then if they vote yes, it'll be implemented at a later date. So compared to the previous policy, there is no longer any consequences for oral sex. Queer men who are in monogamous relationships longer than the previous 3 months, if they are participating in anal sex, they will be able to donate blood, which is a complete change from the previous blanket deferment policy. This also has a very large impact on trans and non-binary individuals. Trans women and non-binary donors who were assigned male at birth were previously subject to the MSM deferment policy when they really shouldn't have been. The new policy removes all gendered language, so this is also going to allow them to donate blood when they possibly were not able to in the past.
So, Cole, obviously what this could mean is there will be more blood in the blood banks, which is good for all of us. But I think there's another message being sent too, right? And I want you to talk about that. The suggestion that somehow, blood coming from one particular population may not be as safe as another population. And I just want you to talk about kind of the impact of that.
Yeah, so it helps decrease stigma within the LGBTQ community. There are so many people for their entire lifetimes, they've been told that, frankly, their blood is dirty, or that they aren't just as healthy when they're partaking in low-risk activities. We've been treated like we're less than. And this is one step forward, closer towards equality in healthcare. And we still have a lot of work to do, including with tissue donation. The FDA regulates tissue donation, which includes your sclera, cornea, heart valves, skin, bones, ligaments, a whole bunch. There's a 5-year deferment policy for if you've had sex with another man for any queer man. These policies are still in place, and we have a lot of work to do, but this is certainly one step closer to helping us, be treated as we're equal.
Right.
Cole Williams, thank you very much for joining us. Appreciate it.
Yeah, thank you.